Today I thought of explaining the fundamentals of ear surgery because the trainees are paying no or very little attention to the fundamentals. So under the fundamentals of ear surgery, I will explain the patient positioning and also how to keep your hands while holding the micro instruments and also your ergonomics. Okay, so the fundamentals of ear surgery. Ear surgery. Remember that the great surgeons are not born. In Indian culture, the ancient Indian culture, the Maharshis or the so-called yogis, they explain that to reach the highest level in any system, a student should have three things. What are they? One is icha, that is in Sanskrit, means what? Desire. Okay, you should have desire. Then you should have jnana. What is that? Jnana means knowledge. Okay. And you should also have one more thing. What is that? Kriya or practice. Okay. So desire, knowledge and practice together make a person perfect in their field. So to become very good in surgery, you should have proper coordination of the practice, your hand coordination and the knowledge of what you are going to do. These trainees become very easily facile with their dominant hand, but you should also acquire facility to work with your non-dominant hand and also a coordination between your hands. And another thing, especially in otological surgery, it takes a quite long time. You should keep a perfect or a proper posture also. And if you are not going to pay adequate attention to your own ergonomics, you are going to suffer chronic backache. And also remember your ears, protect your ears because you are working with high-speed drills which can cause noise trauma also. So I will explain this under the fundamentals under patient positioning. And after that, how to keep your hands while using the micro instruments and also your ergonomics. Among the patient positioning, first I will explain about head positions. So, normal case, the head can be rotated, isn't it? So, rotation. If the patient is lying down, you can rotate the head to right and left. Okay. And it can be flexed. Flexion, or it can be extended. Okay. Extension. Isn't it? Then comes tilt. Yes. So the normal central angle is actually, if it is a central angle, you are tilting the head. Here also you are tilting the head. Tilting the head is not good. So from the smile will be sad on undue tilting. Okay. This is tilt. These are the normal positions or the positions in which you can keep the head. So for an otological surgery, the head should be adequately rotated, it should be flexed and there should be no tilt. Remember that. What will happen if you have kept an under rotated head? under rotated head in extension and with over tilting, what will happen is that you have to keep your hands over the chest of the or the thorax of the patient, and if this is the speculum, you have to keep your hands like this over the chest of the patient, and you have to look into the ear. So then what will happen? It will lead to chronic backache and also chronic neck pain, which is endemic among many otological surgeons. So the correct position should be, you should sit like this, and you should keep your hands over the bed or the cot of the patient or on the surgical table, and not on the chest of the patient. So you should stay like this, or you should sit like this with your straight back and the neck, and you should look into the speculum and to the ear of the patient. For this, it should be adequately rotated, adequately flexed, and there is no tilt. No tilt means what? Ear should be like this. Happy patient, happy surgeon. Okay. No tilt. So the first thing you should keep in mind is that head should be adequately rotated in flexion with the no tilt. Then you can, as a surgeon, you can keep your back and your neck straight with no backache, and also through the speculum you can see, if you are looking into the ear, the patient lying down, tympanic membrane, you can see from the epitympanum up to the hypotympanum. Okay, so your vision will be clearly visible from epitympanum to the hypotympanum through your speculum. So that is the first lesson you have to remember as a trainee. The head should be adequately rotated, flexion and no tilt, so that through the speculum you can see starting from epitympanum up to the hypotympanum, keeping your ergonomics correct. Okay, so shoulder of the patient, you have to remember that ideally you are given a rotation and a flexion and without tilting. The position will be like this. So again you want to give a minimal tilt to the head. One thing you can do is to push the shoulder, opposite shoulder of the patient downwards. This shoulder is, this side, opposite shoulder is pushed downwards. So that what will happen if I am pushing the opposite shoulder of the patient downwards, so that this chin can be tilted downwards or tucked in, and this head can be rotated much more. Okay, so that the ear will come here and it will be more easy for the surgeon. Okay, so you push the opposite shoulder of the patient downwards, so that a much more comfortable position will be obtained. Okay, so regarding shoulder, push it opposite shoulder downwards. And two exceptions to this rule is one in children and in another one adult with a barrel shaped body. In children, the head is proportionately larger than the body, like this, so that the long axis of the ear will be like this. So it will be difficult to see the ear or the tympanic membrane from epitympanum to the hypotympanum. So in this case, what you have to do is you keep a pillow under the shoulder in case of children. And what will happen if you keep a pillow under the shoulders, so that this head will get extended. You will get extension there, like this. Okay, so this will be very well visualized. So you can keep a pillow under the shoulders in case of children, and in persons with a barrel shaped body in which the head is smaller than proportionately smaller than the body, then you have to keep, the ear will be like this. In this case you can see that it is not very clearly visualized. So that you can keep, in this case you keep pillows under the head. Okay, so that what will happen? There will be adequate flexion, and the ears will be more or less in line with the sternocleidomastoid, and also your visualization will be better. After head and shoulders, now it is the positioning of the table. Okay, positioning of table. Regarding the table position, the initial position for all micro ear surgeries is this one. This one is the initial position. That is head up position with the head turned to the opposite side, or the operating ear upwards. Okay. And in this position we can very well see even the posterior-superior quadrant of the middle ear. And if you want much more clarity, especially in case of stapes surgeries, this table can be tilted. Okay, that is tilted towards the surgeon. So that side raised and this side down. You can give a tilt, a minimum tilt to the table sideways, so that it will be more comfortable to see, especially the posterior-superior quadrant of the middle ear. Give a tilt. This is, so this is initial stages, and towards the last stages you have to give minimum leg raising, that is slight Trendelenburg position. In all ear surgery it is first stages it is reverse Trendelenburg with a tilt of the table down towards the surgeon, and in the final stages, especially towards stapes surgery, you give a minimum leg up, that is Trendelenburg with the head down, and at that stages this area or this side has to be raised so that the surgeon can visualize more comfortably. Okay, so initial stages the tilt is towards the surgeon or down, make the part near to the surgeon, table near to the surgeon down, and in final stages the part near to the surgeon should be raised a bit. See, so this is the position of the table in case of ear surgeries. So initial and towards the last, remember to tilt according to the comfort of the surgeon. In patient positioning, remember about the head, that is rotation flexion without tilting, and in shoulder the opposite side should be pushed downwards, and table initially the leg down position and with the tilting according to the comfort of the surgeon, and in final stages, especially in stapedectomy, give a slight Trendelenburg position. And after, the second heading will be micro instrument hand positioning, very important. So regarding the micro instrument hand positioning, the most important one is stability and visibility. Your hand should be stable, it should rest on somewhere, otherwise your hands will get pain after a while and the stability will be lost. And if you hold like this, patients here, I am putting the speculum, and if you hold your instruments like this, then also the structures inside the ear will not be visible. So if this is a sickle knife, micro ear sickle knife, and always hold the instruments with your thumb and index finger, and these two fingers, it should be like this, see, and these two fingers should rest on the speculum, and this should be on the patient's cheek, see. So if here is the shoulder joint, then I am putting my hands on the this joint on the patient's and holding the instrument like this with the thumb and index finger, and third and fourth fingers resting on the speculum, and the little finger again on the patient's cheek, see. So I can very well see the ear and I can manipulate. And if I am putting this suction on this side, I can put the suction also. So the third and fourth fingers will rest on the speculum and stabilize it, and I can use both hands simultaneously with very clearly seeing the ear. Otherwise, if I am holding like this, see, this whole area will be out of vision. Okay, so this is how you have to hold the instrument, like this, with the thumb and the index finger on the instrument, the third and fourth resting on the speculum, and little finger on the patient's cheek. And if you are not touching anywhere, starting from your shoulder joint up to your field of surgery, again it will be very difficult without stability. So the hand should be like this. The elbow should rest on the table, and again your wrist joint should rest on the patient's shoulder, and you should work so that your stability and visibility will be very good. That is 3-point stabilization. Here 3-point stabilization, that is 1, 2 and 3, and 1, 2 and 3. Okay, so the 3-point stabilization, here 1, then here 2, and here comes 3. So 3-point stabilization and better visibility. If you are using the micromotor drill, okay, think this as a handpiece, then also you should hold the handpiece like this, and if this is a working area, I should keep the handpiece like this, and these two fingers should support the handpiece, and the little finger should rest on the head or the cheek or of the patient, that is on the working field for stability. Okay, so two fingers here. If you are holding like this and drilling, it will be difficult. So hold it with the two fingers and support with third and fourth, and then work. Okay, so it will be very easy for you. Hold it like a pen, then support it and then work, even if you are holding the micro drill. Okay. And finally comes the ergonomics. That is how to maintain correct posture as a surgeon while doing surgery, so that you will not be a patient of chronic backache or the neck pain. Okay. And young trainees, you think of 30 or after 30 or 40 years of your practice, and even at that time you should be like this only, without any problems or any fatigue or backache or neck ache or anything like that. So you should maintain your posture while doing surgeries also. So always make comfortable chairs, comfortable chair with an adequate backrest. Okay, so you should rest on this with the adequate back support and sitting. Some surgeons use even support for to rest the elbow joints also. Like this, there is a support. If there is a support, then surgeon can keep the hands on this, and they can use microscope or anything they want for that. And the back and the neck should be straight and the neck should be in the neutral position. That also you have to keep in mind while doing surgeries. Otherwise, the usual tendency is that maintaining a autological slouch position, that is making a forward bending with neck also in the bending position, and you keep your shoulders like the shrunken shoulders. It's very bad posture actually. So make the microscope in such a way that you keep your neck in a neutral position and you work accordingly. If you maintain a flexed neck for a long time, then also it will be difficult for you and will lead to neck pain. Okay, so that you have to remember always. Keep a neutral neck position, and sometimes I have seen trainees looking like this into the microscope with one eye. That is also bad. Always learn to use binocular vision, and this neck position should be not neutral with a straight back also. Avoid leaning too much forward or bending yourself in awkward positions. So that you will not be an addict of chronic backache in the long run. Okay. So this is you have to remember all these basic fundamentals, especially doing autological surgery. Remember this is regarding the patient side. That is, patient's head should be rotation flexion without tilting, and opposite side shoulder should be pulled downwards and the neck tucked in. Okay. And the table you have to tilt accordingly, as I have already mentioned, and the surgeon, the hand should keep the 3-point stability even if using micro instruments, and also while drilling using the micro drill. And in ergonomics, avoid this autological slouch position and maintain a proper stability of your back and shoulders. Okay, so that you can become the best surgeon and work till the end of your long professional career. Thank you.